Okay, this is Seth. He's agreed to help me with my head to abdomen exam. If I were Seth's nurse practitioner doing an exam, I would walk in the room and introduce myself, wash my hands, and explain all the components of the exam. I would explain that I'm going to be touching him and to let me know if he has any questions or if anything is painful or uncomfortable. So first I would start by just looking at Seth's head, noting the shape, that it's symmetric, there doesn't seem to be any like bony malformations or trauma, and then I would go ahead and palpate his scalp. His hair seems to be healthy, there's no coarseness or brittleness. His scalp was in good condition, no lesions or trauma, and there were no bumps or masses throughout his scalp and head. Okay, so then I'm gonna look at Seth's external eye. So his eyebrows, eyelashes, and outer eyes are symmetric on both sides. His eyebrows and eyelashes have a normal distribution and the hair is pointed in the right direction. There's no discharge or swelling in his external eye, and his irises are the same color and the same size and shape. So then I would just gently pull your eyelids down, noting that this glare is white, there's no yellowing or jaundice, and his conjunctiva are appropriately red and pink. There's no extra irritation or redness to it. And then I'm gonna have you flick off the light real quick. Thank you. Okay, Seth, look above the camera for me. I'm just gonna shine a flashlight in your eyes. In the middle. Okay, perfect. So the light was shining equally in both eyes, so his corneal light reflex is positive and intact. And then I'm gonna have you follow my finger. Perfect, he's able to follow my finger with a fluid eye motion, meaning that his extraocular muscles are working. And then I'm gonna have you follow my finger again. Okay, so his eyes are able to follow my finger inwards, meaning that, and his pupils were dilating and constricting appropriately with the movement of my finger. Okay, now we're gonna look inside your inner eye. I'm gonna brace my hand against your head. Pull up your eyelid a little bit, perfect. Okay. Other side. Okay, so his retinas appear red and normal. The optic disc is in the appropriate location, and his lens and anterior chambers on both sides look clear. There's no cloudiness or foreign bodies. Okay, so then we would go on to assess his ears. First, we're just gonna look at the outside. We see that the ears are symmetric and located in the right place. There's no swelling or trauma to the outer ear. Gonna look in the external ear canals on both sides. There's no obvious discharge or disruption of the skin. And after I've assessed both sides, I'm gonna gently palpate his ears to check for any pain or tenderness. There's no masses noted there. I'm gonna give it a nice tug too. Any pain with that?
Nope.
Great, okay. All right, and then we're gonna look in the inner ear. Will you hand me that? Thank you. Okay. Okay. And then I'm gonna brace my fingers against Seth's head and pull his ear back and up to look inside. All right, now we'll check the other side. Same thing. I'm way off the wheel. Okay. So there doesn't seem to be excess wax buildup in his inner ear. The skin looked intact and pink, and his tympanic membranes were not bulging or sunken in. They're kind of a pearly gray color with appropriate light reflex, and the bony landmarks were visible as well. Okay, so then I'm gonna look at the outside of Seth's nose, noting that it's symmetric, there's no trauma or swelling of any kind. The septum appears to be midline. I'm gonna have you push the tip of your nose up. And then I'm gonna peek with this scope from the outside on both sides. And I'm noting that the mucosa and turbinates are pink, moist, and intact. His septum is midline and intact. There's no deviation or perforation. And then I'm gonna have you cover one nostril and take a breath in and out. Perfect. And then other side. Perfect. So he is able to breathe through both sides of his nose. Both nostrils are patent. And then we're gonna go ahead and inspect Seth's mouth. Okay, the external mouth looks healthy. There's no lesions, cracking, or sores of any kind. The lips are pink. I'll have you open. Excellent. His buccal tissue and tongue look healthy and pink. No lesions or irritation. Can you lift your tongue up? Perfect. His subglossal area, there's no abnormal bumps or discoloration, and his gums look healthy and pink. His teeth are intact, no chipping or decay of any kind. And then I'm gonna have you open your mouth and tilt your head back a little bit. Okay. So his soft and hard palate are intact. His anterior and posterior tonsillar pillars and uvula are in the right location. They don't appear to be enlarged or irritated. And his the back of his throat looks pink and healthy. There doesn't appear to be any postnasal drip. Okay, and then we'll move on to Seth's neck. First, we're going to inspect the musculature. Looks normal. There doesn't appear to be any obvious deviation or swelling of his trachea or thyroid. And then we're going to go ahead and palpate the neck for any tenderness or lumps. I'm going to palpate the trachea. It has good movement and it's sitting midline. And I'm going to palpate the thyroid. Then I'm going to have you swallow. Perfect. So the thyroid tissue is soft and spongy, and there was appropriate movement when you swallowed. I'm going to have you swallow again without me touching. Perfect. And there was appropriate tracheal movement as well. Okay, and then we're going to palpate some lymph nodes, feeling for enlargement, hardness, or tenderness. I'm going to start with the preauricular nodes, postauricular nodes, occipital nodes on the back of the head, and then the tonsillar nodes, submandibular, submental. Then we're going to palpate the posterior cervical on the back of the neck and the anterior cervical on the front. The last nodes we're going to palpate are the supraclavicular, and none of his nodes are really palpable, which is normal in a healthy person. Okay, we're going to have you tilt your neck back and forth to check your range of motion, and then side to side, and then take it around in a circle. Any pain or tightness with that? No. Okay, so he has appropriate range of motion. Then we're going to move on to his chest and thorax area. First, we're just going to inspect. We note the rib cage is intact. His chest is the appropriate AV ratio. There's no barrel chest or asymmetry noticeable. And then we are going to go ahead and auscultate. And before we do that, we just note that his respiratory rate is relaxed. His respiratory rate is normal. His respirations are relaxed. There's no obvious presence of kyphosis, and yeah, he's breathing easily, unlabored, no noise that I can hear so far. Okay, and then we're gonna auscultate on the chest. Okay, start taking some deep breaths. Perfect. Deep breath. We're gonna do the same thing along the back. Can you rotate with your legs towards me? Oh, yeah, towards you. That's even better. Okay, keep taking deep breaths. Perfect, and then I'm gonna gonna get under your arm here to listen to the middle lobe. Deep breath. Perfect. So all of his lung fields sounded clear. No crackles, rhonchi, wheezing, and again, hypothetically, his shirt would be off to be able to listen better, but we'll let him keep it on for the purposes of this video. Okay, and then we're gonna auscultate his heart in the 5 areas, first with the diaphragm and then with the bell. So we'll listen to the pulmonic area, aortic, Erb's point, tricuspid, and mitral. And we're going to flip and listen with the bell to the mitral, tricuspid, Erb's point, aortic, and pulmonic. And I didn't hear any arrhythmias. His heart sounded regular rate and rhythm, and I didn't hear any thrills or anything like that. S1 and S2 were also present. Okay, actually first we're gonna have you lay down too. We're gonna listen to your heart while you are supine. And as he's laying down, I'm not noticing any jugular venous distension, which is good. I'm going to listen to those same 5 points, again with the diaphragm first and then the bell. Okay, listening to the pulmonic, aortic, Erb's point, tricuspid, and mitral. Then again with the bell to the mitral, tricuspid, Erb's point, aortic, and pulmonic. Perfect. Next, we're going to look at his peripheral vascular health. So his limbs all look to be an appropriate color. There's no edema or varicosities. And then we would check his pulses, noticing that the temperature of his extremities is warm, and again, there's no edema. For checking his radial pulse, we would also check the femoral pulse. And then the dorsalis pedis on both sides, and the posterior tibial. Those all felt normal. There was no clubbing in his fingers or toes. And all the pulses felt even on both sides, no bounding or threadiness or anything like that. Okay, then we'll move on to inspecting his abdomen. First, we're going to notice just the shape and contour. There doesn't seem to be any problematic distension or any sunkenness of the abdomen. There's no hernias, masses, scarring, anything abnormal like that. And then we would go on to the auscultation. So we're going to auscultate the right lower quadrant, right upper quadrant, left upper quadrant, over the gastric bubble, and the left lower quadrant. All the bell sounds were present. And then we're going to listen with the bell for the aorta and renal arteries. Listen for the aorta right here. And then the left and right renal arteries. Perfect. So those all sounded appropriate. No obvious dysrhythmias or interruptions. Okay, next we're going to percuss his abdomen. First we'll do general percussion. taking note of any areas of dullness. And his abdomen sounded appropriately tympanic, no unusual dullness found anywhere. And then we'll go ahead and percuss his liver as well. We'll start kind of at the umbilical line and mid-clavicular line. And percuss till we feel dullness at the liver's edge. Come up here to the nipple line and percuss down until we hear dullness again. The margins of his liver are about 7 centimeters apart, which is normal. And then we're going to percuss his spleen. I'm gonna have you take a deep breath in and out. Perfect. So that was tympanic the whole time. There was no dullness, which would suggest splenic enlargement. And then we will go on to palpation. First, we will start with light palpation in all 4 quadrants. Any pain? And then we'll move to deep palpation in all 4 quadrants again. We will also palpate the aorta. Perfect. And the liver. I'm going to put my hand under you. Take a deep breath in and out. Perfect. Let it out. Palpating under the rib cage to feel the edge of the liver there. And then I'll put my hand on the right side as well. Take a deep breath in and out. And deeply palpate to feel the spleen. I didn't feel the spleen, which is a positive sign. If you were to feel the spleen during the respirations, it would be a sign of splenic enlargement. And then I will also palpate the right kidney in the right side of his abdomen. And that feels benign as well. Yeah, we got that. Okay, so after we palpate the aorta, we're going to make sure to also palpate the inguinal lymph nodes, which we didn't do earlier. They don't feel hard or rigid or enlarged. Nothing much to note there. And then throughout the whole exam, we're going to be looking at his skin. It's all warm, dry, and intact. There's no abnormal hair distribution or ulcers or discoloration indicating poor perfusion anywhere. And yeah, so that is pretty much it.